That's the sound of the coffee pouring. Welcome to the Doctor's Brew. I'm your host, Dr. Abdulaziz Al Khayyat. Joining us today is Dr. Hala Allafi, and our topic today is fashion in medicine.
Hi.
So a bit of a background on this topic and a bit of a background on Hala. Fashion in medicine, I know that this may seem like a bit of a superficial topic right now, but by no means is it, because it relates to professionalism. It relates to the way that, how you present yourself in the hospital, on the streets, everything. So I don't think there's anyone more perfect than Hala to discuss this, because she would often say in med school that if it wasn't medicine, that she'd be going into fashion. Is that true?
Yep.
Let's just dive into it. Before anything else, Hala, can you tell us a little bit about yourself for our viewers?
Yeah, I'm Hala. I'm a doctor. I just started working a few months ago in Kuwait.
Mm-hmm.
I'm a University of Manchester graduate.
With me?
Yep. So we go way back.
Mm-hmm.
And yeah, I feel like it's a cool topic. Fashion in medicine. Fashion is something that I've always been passionate about. Something that I feel still has a role, even though I'm a doctor. It doesn't necessarily have to be something that you do on the side or something that's completely out of the picture for me. So, yeah.
I mean, case in point, I showed up in scrubs and Hala's in a full-blown Devil's Wear Prada suit. But yeah, no, I definitely agree. One thing that was a thing for our university, we talked about this quite a bit, was in our university we had to wear these gray scrubs that they assigned to us. With all honesty, Hala, disagree with me if I'm wrong here, they looked horrible.
They were ugly.
They were very, very ugly.
They were really bad. And the fit was horrible as well. Like, some people just don't care about how scrubs may look. They just want comfort. But the comfort wasn't in or the look or the fit. It was just a big fail.
Yeah, no. It was the material was bad.
Yeah, it was very itchy.
It was itchy. It looked like I was wearing a tent, which was not nice.
Yeah.
So, me and Hala, what we would do is we went out, got our own gray scrubs because we didn't want to deviate, okay?
Mm-hmm.
We'd kind of go to the hospital in that and just pray that nobody caught wise.
Mm-hmm.
Yeah. So I think what that alludes there is that fashion in medicine is all about how you present yourself. Would you agree?
Yeah, it's about how it's the first impression people get of you. Like, people can say that they don't care about clothes, they don't care about the outer appearance, but it's very important, especially when you're a professional and you're working in that type of field. The first thing people see is it's the first impression that you'll give them. So it is very important to take care about how you look, like at least being well-kept and looking clean and looking professional. Like, to me, that's a bare minimum that any professional should be doing.
But okay, to play devil's advocate a bit, one thing that's an issue in our field is that we work weird, strange hours. So, what would you say to someone who's fresh off of an on-call? Like, I know I've come off an on-call shift and I look like a bus has ran over me. And I don't want my first impression for patients to be that, you know what I mean?
To be fair, we've all been there, but we're also blessed to have on-call rooms with showers in them, just having a mini bag with perfume, deodorant, just spending 5 minutes in the bathroom just washing your face and freshening up.
Sure, okay, but what
if you don't have the time?
Not just don't have the time. Why is it important? Why should we prioritize it? Yeah, I'm just playing devil's advocate. I'm not advocating for anybody out there to be, showing up to the hospital stinky. Can I?
To be fair, it's more of a thing I do for myself. I always say, if you look good, you feel good. Like, on my worst days, you'll see me with full-blown makeup, high heels, and a really nice dress, and I could be really depressed. It's just how I coped, especially during exam week. I'd be that person walking into the library looking like she just came out of a fashion show, not because I'm trying to impress someone. Mm-hmm. It's more of a coping mechanism that I have for myself. So it's more of something that you do for yourself. If I feel clean, if I feel like I look presentable, I feel better and I give more out of myself. Mm-hmm. I feel like most of the people that I know feel better when they feel clean and well-kept. So to me, that's a bare minimum. Like, you don't have to look like you just walked out of, I don't know, New York Fashion Week.
Not everyone is Hala.
You don't have to turn heads or anything. But at least looking clean so that patients, I don't know, I wouldn't want a doctor that looks, like they haven't showered in days treating me.
Yeah.
You know what I mean?
Yeah.
Like, to me, that is at least the bare minimum. You don't have to, like, reek of cologne. To me, that's very unprofessional.
That's one point.
I hate that. I hate that.
Yeah,
You
yeah.
can smell good and not smell like, floor one of Selfridges.
So you said the phrase "look presentable." Define it. What do you mean presentable? Because I think it's a very subjective definition.
It is very subjective. You're right, and I feel like that's why some hospitals have rules. Because it's a very, like, you can argue any point. You know what I mean? Like, to me personally, it really depends. Like, let's say you're in a hospital that doesn't really have rules in terms of what color scrubs you wear, like where we work in right now. You don't have to wear scrubs. You don't have to, like, you can wear basically whatever you want, but look presentable.
Sure.
So, like, the rules aren't very, set in stone. It is a bit more difficult to be like, you look professional, you don't. But it really depends. It really depends. I feel like if hospitals had a few rules that you'd at least, take as a manual or something and just work around it, it would be much easier. But it really depends. Like, for me, as long as you look clean, as long as you can work in the outfit that you wear. For example, I don't think
That's a
it's
good
wrong
point.
to wear high heels, but I'm not going to wear one when I'm on call and a code might happen.
Right.
You know what I mean? Because that will slow me down running to the code, and that will affect patient care. Therefore, it's inappropriate.
Not to deviate, but I can imagine you, like, a code is happening, you just take off your high heels
Take
and
off
throw
my
them at
heels.
the
You
wall.
know that's something I would do. Yeah.
Yeah.
Like, I always have a hair tie on me just in case, like, someone codes. I don't want my hair all over them. I don't want secretions all over me. You know what I mean? It happened to me before. Yeah, so
Go on.
I've always got a hair tie on me no matter what. I always wear comfortable shoes. I make sure they're clean. Just simple things like that. Some people are like, but some people have really weird hair colors, and I don't think that's okay. I personally don't care. I think it's fine if you want to have funky hair colors and cool tattoos, as long as it's not, doesn't say anything offensive on it. I think
You're bringing up an interesting point here because I think there is a cultural element to this. Would you say so?
Very. Here, very.
Go on.
I see people raise eyebrows when they see people with, like, unnatural hair colors, like things that don't exist in nature, or like a lot
That
of
don't
tattoos,
exist in nature.
like blue, like like you're not born with blue hair. You know what I mean? Like, it is a synthetic color. Things like that. I don't know, like men with super long hair. Some people don't like that.
I chopped my hair off. So
I remember.
Before starting in media, I had really long hair, like down to there, and I chopped it off because of that. Now that's kind of, that was also one of those situations where I didn't want to do something, but I felt like I needed to do it for my professionalism. Do you think that was the right decision, though?
To be fair, it would make your life easier here. But I don't think it was unprofessional, because I worked with you. It looked fine.
But what do you mean makes your life easier here?
I don't know. Like, long hair is not a very... Like, long hair on men here is not a very common thing. Like, you see it more now.
Yeah.
But, like, especially doctors, you don't see that a lot.
Yeah.
You don't see it a lot.
You don't.
I like it. I personally like it. We're already restricted by so many things as doctors. Our schedules are horrible. You're in scrubs most of the time. Like, we've already got so many restrictions. Like, I don't like to restrict someone's self-expression. To me, that's very important. We're all individuals at the end of the day. I don't like it when we all blend and look the same. That's so boring.
No, I definitely agree. But, okay, what I want you to imagine is, think of you have a nephew, okay?
Cool.
He just graduated from med school, and he comes to you and he's like, Auntie Hala, I'm about to start in the hospital. What should I do with my long hair and my ponytail? What would you realistically tell him?
Honestly,
Honestly.
do what you want,
Okay.
but be very convinced and just don't really care what people say. As long as what you're doing isn't wrong, I don't think it's wrong. Just have a hair tie on. You know how to tie your hair, like rock a man bun. You know what I mean? Like
Definitely, yeah.
yeah, like I don't think it's wrong. So why follow into the social norms? You know?
And I do like that. I like you touched up on, saying we have a lot of these limitations in medicine, and it's absolutely true. As doctors, I feel like we always have all these limitations, especially as trainees, because we're still finding our way a little bit. I feel like those little outlets where you can be yourself. It sounds ridiculous, but really, fashion, what you wear, your hair, all that kind of stuff. That is, those are the outlets where.
Yeah, it's a form of self-expression. Like, to give an example, like I do wear scrubs like everyone else, but I wear like funky undercolor scrubs. You know what I mean? Like I wear pink, I wear blue, I wear green. I make sure it matches.
So you don't wear green pants and then pink top?
No.
Okay.
No. Yeah.
Fashion tip of the day.
Yeah, I just like to play around it and be creative. Like I'm still in scrubs, I'm still comfortable, I still look presentable, but at the same time I don't want to look boring. You know what I mean? Like or like just having really cute hair accessories that don't fall off. You know what I mean? I don't know, like I used to show up with like 2 little mini ponytails. I don't know, I thought it was cute.
What's the line then? What would you say is the line, your advice to people?
My advice, when it comes to what exactly?
So, again, going back to this example of you have someone you're related to just graduated from med school, they're about to go into the hospital, and then you need to sit them down and just teach them all about how they should be dressing up for, the hospital. Okay.
Honestly, I'd say, look, one simple rule is that you, like, if I look at you, I'd want to be able to, like, yeah, this person looks professional. You know what I mean? Like, business casual is the way I'd say. Like, I wouldn't wear a full-blown suit and tie. I mean, go for it if that's what you like. Yeah. But, like, just look business casual, like you're just showing up to work, unless you're in scrubs. I think business casual is a good way to place the line. Like, I wouldn't wear a dress that just stops at my thighs, you know what I mean? Like, I wouldn't wear something that short to work. I don't think that's professional in any work setting.
And one thing to note, you'll notice on the trainee evaluation form, so anyone listening that's wondering like how important this is, on the trainee evaluation form, one of the things that they judge you on is appearance. And if you're dressed appropriately, because patients will not want to be treated by doctors that don't come across as professional. So then,
like, there are a few things that are a bit like gray, but to me there are a few things that are black and white.
What's gray?
Like, for example, when you said, like, what advice would you give someone? I was like, it really depends on what hospital you work in. If you're in the UK, it's very easy. I'd be like, no earrings, no necklaces, and only wear a wedding band. No white coats, because those are banned. And make sure you wear the hospital scrubs. Very, very easy. In Kuwait, it's a bit more gray. One topic that I find black and white is, I think long nails are gross as a doctor. I am really sorry. I've seen some beautiful manicures, but please, just, I don't know, cut your nails short. If you're working in the hospital, they will break. I don't think nail polish is an issue if you're not working in a surgical department. I think that's fine.
Wait, so why surgical?
Because when you scrub in, you have to scrub the actual nail itself as well. So I get that.
I do not experience.
Yeah. Yeah, you'll get yelled at by a scrub nurse if you've got nail polish on. I promise you. Yeah, it's going to happen.
Okay. I never actually factored that in. That
Been
was
there.
A thing.
Yeah, a dear nurse, a friend of mine, I don't know if you remember her from med school. She used to carry acetone everywhere with her because of me. Yeah, because I always had nail polish on during her training sessions, and she'd make me take it off in front of everyone. Yeah, nurses are very strict.
Nurses in the UK.
In the UK, they're very strict.
Talking about the UK, so what's the difference culture-wise, fashion-wise for the hospital there versus here?
It's completely different. It's like night and day. Like in the UK, like the doctor culture there was very like, I don't really care, whatever. Like people didn't really put in that much.
What do you mean I don't care?
Like
Fashion-wise or in general? Like they just don't care?
no, fashion-wise.
Okay.
No, they care about their job. But I mean, like fashion-wise, it wasn't a big priority. Like people, like before COVID, everyone just wore business casual unless you worked in theaters.
True.
So people would just be in business casual, very plain Jane, I'd say. Very plain Janey. And I don't like that. I personally don't like it. It looks professional. It looks smart. But like I like a form of self-expression when it comes to clothes. I just personally like it. I don't think it looks bad. It looks really good. It looks professional. That's what you want from a doctor. But to me, I love self-expression. I love how people dress up really nice here. I think it's amazing. I just walk into a meeting. It's like a fashion show every day, and I love it. I live for it.
So would you say that on a fashion sense, it's a bit better here than there?
In my personal opinion, it's much cooler. Yeah, it is much cooler. But I wouldn't say that. They look less professional here. They look more professional there, or they're more. It's just a personal thing. Some people might be like, no, they look more business casual. They look more serious there. But I personally like to see self-expression.
What's more functional though, the culture of the fashion culture there or here? Functionality.
It really depends, because there are some rules there that I don't completely agree with. Like, you're not allowed to wear necklaces at all. And I get it from a safety point of view. Like, what if someone yanks it out? But like,
is that why you're not allowed?
I think so. Like, what if a patient gets very aggressive and tries to yank it out? But they can easily pull my hair or scratch. You know what I mean?
I'd imagine that more likely in Kuwait than the UK.
Exactly. Yeah.
I'd expect if I heard a story about patient grabbed my necklace, I'd be like, okay, which warden Amiri?
Honestly, yeah.
Yeah.
Another thing is white coats are banned in the UK for like cleanliness reasons. They've done studies and germ spread because it's like you're not bare below the elbow.
Yeah.
It goes off to your wrist, and so when you're treating patients, it brushes off one patient, then you're onto the next one, and then MRSA's everywhere, you know, especially during times like COVID, those rules really helped out because we were already used to it. We were bare below the elbows. White coats are not a thing in the UK. You will not see a doctor wearing a white coat. That is so like, I don't know, 20 years ago?
But I don't know the rest of Europe, but I know that's not a worldwide thing. I think
doctors in the US still wear them all over. I think it's just the UK.
Maybe.
I'm not sure if other countries are the same, but in the UK they don't wear lab coats. Even ties, because when you're leaning over a patient, the tie might touch this patient, then touch the other one, then this way you might spread germs. So they don't wear ties. I think it's okay as long as you make sure it's secured. There is a way of securing a tie under your shirt tuck it in.
Yeah.
So I don't like just banning things, you know what I mean? Like the white coat thing I get, but you can still wear it.
I don't like white coats. I don't wear them, but I like them.
I like them because when I wear business casual, like, you know, women clothes don't have as much pockets as men, and I live for pockets. So like, especially if I'm wearing a dress, I won't have any pockets, so that's why I like to pop a white coat on top, because you've got pockets on those.
Oh, like in the hospital, you mean?
Yeah.
I don't know why I was imagining you mean like
Rocking Upton Avenues.
Yeah. You're going to the avenues. You're like, I need pockets. Oh, that's my coat. But you know, because of the UK, I still don't feel comfortable wearing a white coat.
Yeah. Like, I always feel gross when I wear one, even though it's like clean.
Yeah.
Well, one thing we didn't talk about is because in the UK they iron and they press your scrubs for you, but in Kuwait it's more of a we rely on you to be clean type of thing.
You know, I was actually looking this up online and I was reading through like a chat or something, like some message board, not message board, like Reddit. What's Reddit? Anyways,
I love Reddit.
They were mentioning how someone wrote like, ew, I would hate the idea of people needing to clean their own scrubs because I'm a nurse and the hospital grade is so different than what we can do at home, and that's so gross.
Yeah, and traveling in scrubs as well, leaving the hospital in them and not coming in them. Like, in our hospital, you weren't allowed, you change when you arrive and you change before you leave. And if you're scrubbing into a procedure, you change again into new scrubs and then you throw those away. When I did a rotation here, I you don't really change into surgical scrubs, even in surgery.
Oh, really?
You will-
I didn't know that. Okay.
yeah, like you'd just scrub in and you'd wear the gown and everything. I don't know if the rules have changed,
Okay.
but in theaters here,
At least before,
it's
when
not-
in
it's-
your experience, when
yeah,
you went
like
before,
the last time I scrubbed into surgery here was like
Yeah.
5 years ago, so I don't know if the rules changed,
Okay.
but people would be wearing their home scrubs. And they just scrub in and wear a gown over.
I mean, you know,
I don't know
it's-
if that is in every hospital. I don't know if the private sector is different, but the rotation I did, those were that's what flowed.
Well, you know, like, you know, in terms of infection risk, we're thinking patients, but also, what about ourselves? You know, when we come home, we have family, we have friends, we have people we're interacting with, and we're gonna be getting we could be carrying God knows what diseases on us. And I have to be honest, I am guilty of, you know, leaving the hospital in scrubs because scrubs are so comfortable.
They're really comfortable. It's like pajamas.
Literally, it's like wearing pajamas, but then looking official
Yeah.
all the time.
We're really privileged.
Yeah,
I can't think of any other job where people can do that.
No, really. Like, and in general, I don't know if you've noticed. Actually, I'm certain you've noticed. In Kuwait, there is this culture going around Kuwait, not just like in the hospitals and stuff, but there is this whole culture of like wearing your uniform everywhere. Like you see I believe the engineers with
the popo, everyone, yeah.
Everyone loves wearing their uniforms.
Yeah.
And I don't think we're any different as doctors.
I mean, to be fair, like sometimes you're put in a position where like I don't have time to go home and change.
That's the thing, yeah.
That's when I'd be caught, you know, in scrubs. But I don't like it. I have really nice clothes at home. Why not wear those? You know what I mean? Like my closet is about to pop.
Yeah.
So many new outfits that I haven't tried. I don't like walking around in scrubs if I have the option. But
This is where we
sometimes
differ.
it's like you've got a half an hour break and you just want to go grab coffee in Kuwait City somewhere and you just show up in scrubs.
Like,
or you want to study after work and you don't want to go home and change and you know it's going to waste time. So it does happen, or you have to run errands. It does happen.
Like for me, I'll tell you, like, because my thing is after work, if I go home, I'm done for the day.
Yeah, you
know?
crash.
I crash. I'm
Yeah,
not going to be able to study. I'm not going to be able to run errands. None of that is happening. I am out. Bye-bye. So after work, I keep going and I run my errands. I go, I study. I do whatever I need to do. And the scrubs are comfortable. It's what I'm wearing. And it's so annoying carrying a change of clothes with you everywhere.
It is, yeah.
Yeah.
It can be very impractical as well.
Yeah. And not to mention that, like, thankfully in Kuwait, it is normal to see people in scrubs walking around. It's not like in the UK. You would never see someone wearing scrubs like in public, like in a mall.
Yeah, like when I left work and I didn't have a change of clothes, I wear a very big coat over it and no one would notice the difference. I wouldn't just walk around, you know, the city center with scrubs on.
Yeah.
Like one would think it's gross, especially during COVID. People were so scared. Like whenever I used to take the train or something, like they just see the NHS badge and they just move away because they're like, "Ew, doctor, germs." You know, like imagine if that was me, like after a night shift or something, and just jumping on the train with like scrubs on. Yeah, that's an easy way of getting a whole carriage to yourself, though.
But you know, in terms of infection risks, one thing that we've failed to factor in here is also the weather. It's winter now. Everyone is wearing sweaters, jackets, hoodies, whatever it is, on top of their scrubs in the hospital because it gets cold.
Yeah, it gets really, really cold.
But ew, right? Like if you in terms of infection risk and carrying bacteria.
That's
and
why
like
I wear under scrubs. I don't wear jackets when I'm like just
what
wear
do you mean
a
under
thermal.
scrubs? Oh, like thermals.
Like the top under the scrubs.
Yeah.
I wear that. I wear those all the time because it gets really cold in the hospital. Even during like summer, I wear the really thin ones, and then in winter I'd wear a thermal under, and it's very easy. Like if I'm gonna examine a patient, I just like pull them up and make sure I'm bare below the elbow before I gel my hands and examine them.
But what about getting them clean? Is it this like you know what I mean?
Yeah, it's fine. Just pop them in the wash.
In the wash.
Yeah.
Sorry, the very British statement there. In the wash. That's not. Oh, that threw me back to Manchester. Okay. After popping them in the wash. So you've thrown them in the wash, and compared to the hospital, like, what about that whole debate again of the hospital can wash better than us at home?
I mean, they can only do that if you wear hospital grade scrubs. You know what I mean? Like, they're not gonna wash my figs. You know what I mean? I'm like, hey, like I've got a pile of stuff. Can you just wash them for me? They're not gonna do that. It's very hard to implement.
True.
But if we had a uniform, and like, let's say all trainees wore one colors, consultants wore one colors, physiotherapists
I would
wore one
love that
colors.
Actually.
That would be very easy to recognize other people, to be fair.
Yeah.
But I don't know. At the same time, not everyone wears scrubs, so the confusion will still be there.
True.
You know what I mean? So many doctors, I've never seen them wear scrubs. They're more of a
usually the higher ups don't wear.
The higher ups don't really wear them that much until COVID hit.
Huh?
Until COVID hit.
Really?
When COVID hit, everyone started wearing scrubs. I didn't recognize half the consultants I worked with.
I actually can't imagine it.
Yeah, honestly, like all the consultants that I worked with in the UK, I'm like, yeah, I know this guy. And they're like, oh, he's wearing scrubs. It's so different.
Yeah.
And then you're like, they look like me, and before, like, I don't know, look like a distinguished gentleman. It's so different. This is why I'm just like, what you wear really reflects on how you think and your personal style. So when we had that jump, it was like, it really did look like a hospital. You know what I mean? Like when COVID hit, it was so bad.
Yeah.
Yeah, everyone looked the same. It was quite boring.
But okay, so then, yeah, it gets boring that everybody's wearing.
But we
the
needed
same
to do
color.
that.
Yeah, we needed
at
to.
that time. Honestly, cleanliness overlooks. Like we had to wear the N95. I didn't wear makeup for months. I mean, because it would just ruin it at the end of the day, and you'd get all sweaty and gross. So at a time like that, looks really did not matter.
But
you know what I mean?
To change kind of like the. Everyone's wearing scrubs, but how people change and kind of differentiate is a lot with like scrub brands, right? So then you have like Figs, you have
Shout out to Figs.
Shout out to Figs, Skechers. I don't know Barco. Is that part of Skechers? I'm not sure.
Barco, Grey's Anatomy.
Grey's Anatomy.
And then you've got the local brands.
So that's one thing I did want to talk to you about is local brands in Kuwait, because that's one element in Kuwait that I really, really love. Like,
Same.
I love the fact that there's local brands making scrubs in Kuwait, and that's what people use, because I guarantee that was not a thing in the UK.
No, it wasn't.
Yeah. So that's okay. Comment on that, because I'm also not as versed as you are.
Yeah.
In local brands of Kuwait.
So in Kuwait, a lot of the marketing happens through Instagram. So
not a lot, exclusively.
Yeah. So like I find a lot of pages that sell scrubs. And I can tell like it's a Kuwaiti woman's creation just by looking at the style. It's really, really cool. It's like they're scrubs. They're also stylish. They're also catered to women that wear a hijab. Okay. Because like here, you don't have to be bare below the elbows. It's not against the rules. You know what I mean? Because a lot of women cover to like until the wrist because they wear hijab for religious reasons. So a lot of the scrubs are long sleeves or they've got a jacket.
That's really
on
nice,
top.
actually. That it's more inclusive.
It is more inclusive, and it's really cool. It's also more inclusive in terms of style. Like you've got really cool colors, you've got really nice cuts. So it is a less boring way of wearing scrubs, I guess.
But what about the fabrics? Would you be less trusting of local brands in terms of because scrubs are usually made out of antimicrobial fabrics. Yeah. Or do they usually follow?
I'm not quite sure.
Know.
Not all brands talk about those things, or I don't know. Like not everyone that opens up a scrub brand really, I don't know, prioritizes. I guess the material in terms of cleanliness. Some people prioritize, I don't know, comfort. Like, is this material comfy? Is it stretchy? But most of the ones that I've seen don't really look like the scrubs that we wear, like the Figs ones or the, you know what I mean? Like they don't look like they're the same material. I'm not sure about all of the other brands. They look cute. I've never tried them. The local ones, I've never tried them. So I don't know, but I've seen them on my friends at work and they look quite cute and they say that they're very comfortable. But in terms of antimicrobial properties, I don't know.
Yeah,
I don't know.
that's one thing I did wonder before because you can't necessarily just go and you can't even just make you shouldn't at least make custom scrubs because they should be made out of a certain fabric. Although no, that's
But
that's
to
not
be
true.
fair, the scrubs that we wore, now I'm being devil's advocate. The scrubs that we wore in the UK, they were just cotton. You know what I mean?
Yeah,
Like
but
they
they
had
were also
zero
like
antimicrobial properties, but they were washed and pressed for
yeah,
us.
that's what I mean. They probably went through like they were like semi-burnt probably. Like you could tell
Yeah.
the colors were
But to
faded
be
after
fair,
one wash.
once it got washed and ironed and you wore them, the germs just pile up. You know what I mean? So like, I don't know if the antimicrobial properties like work throughout the day. You know what I mean? Like a lot of the scrubs that I wear are like waterproof or like caffeine stain proof, and I think that's awesome because like I'm a klutz. I will drop coffee on me 5 times a day.
Yeah.
You know what I mean? So
Now, one thing about scrubs in Kuwait, we don't really think about it a lot, but in a lot of schools, one of the reasons that uniforms are used in schools, I don't know if this is a reason in Kuwait, but I know at least around the world, one of the reasons uniforms are used in schools is because for people of different economic backgrounds, that there's less of I'm trying to think of a nice way to put this. Nobody's flexing on anyone else.
Yeah.
You know what I mean? And it doesn't single out, for example, like let's say there's some kids that are wearing all the top brands and there's one kid who's not. They want to avoid bullying. So do you think that, kind of, although it's great fashion-wise in Kuwait that in the hospital that we have all these different brands, all these different styles, do you think that it does create a bit of a toxic type, I have this brand, I have that brand system in Kuwait?
honestly, I felt like it was more of a middle high school thing than it is in hospital. I rarely see this. People like the people that I've met so far are quite humble and quite chill about it. I've never gotten judged for not wearing like a really nice watch or really nice shoes. You know what I mean? Like no one really cares or bats an eye. They might think it, but I don't know. No one's really said anything to me about it.
I haven't had
and
that
to be
experience
fair,
either.
I also do like the idea of wearing something unified. Like I worked in a hospital called Bolton Hospital. I think you're familiar with that one, Aziz.
Just
PTSD.
a little deviation here. Bolton, my memory of Bolton was that we had to stay on hospital campus, and like because it was so far away from Manchester. And when I was there, right next to me were horse stables, like where we were
I
staying.
remember. I used to see them from my room.
So you say Bolton, I say horses. So,
Yeah.
anyways, Bolton Hospital.
Yeah,
continue.
so when I worked in Bolton, I did a emergency room, like A&E placement. And what I loved about the A&E placement was that everyone wore blue scrubs. The doctors, from the consultants to the regis to the junior doctors to the porters, the nurses, the physiotherapists, the cleaners, everyone wore blue scrubs. And I love the fact that it unified everyone, but it was very confusing. It was
Okay.
very confusing. Like I didn't know who was who.
So do you think that people should be separated kind of by like, the word is not rank, but I guess profession. So it's like nurses and then junior doctors, more senior doctors, consultants, et cetera, et cetera.
Yeah, like nurses in the UK had like they like you can tell what type of nurse or what type of band nurse you are from your uniform. I can tell. Okay, she's like the big boss nurse. This nurse works in A&E because she's wearing scrubs.
Yeah.
This nurse works in pediatrics. This person is a phlebotomist because they're wearing gray. You know what I mean? Like it was much easier. Usually it's the doctors that it's more of a gray area. Like just wear what you want.
Yeah.
You know what I mean? But in most posts, in most jobs, they had a uniform. You know.
And I, kind of drawing back to what you mentioned earlier, I think the lack of hospital policy in Kuwait, I think that's something that could be improved upon. I think it would be really beneficial for there to be more of a unified hospital policy in how people can be able to dress.
To be fair, there might be one, but it's not implemented
Or it's not communicated.
And it's not communicated.
Yeah,
you know what I mean? Like I'm not aware of it. It's something that you should be aware of day one of your work. You know what I mean? These are the rules. Don't break them.
Yeah.
But I'm not aware of
that was a
anything.
big thing for us in the UK was the dress code stuff.
Yeah, not just a dress code. Like when you first started, you got fire safety training, you got moving and handling training. Like you show up to work knowing, okay, if something really bad happens, I'll know what to do or at least who to call. Here it's more of a you pick it up as you go type of thing.
Now, moving away from the scrubs and more to the face, makeup.
Yes.
What do you think are the rules with makeup and being on the job? Is it professional to put makeup? Is it unprofessional to put makeup? What is it?
The thing about makeup is that it's a very, very interesting topic for me because I think makeup is a really cool way to self-express.
Okay.
It's a very nice and forgiving way of covering up imperfections if you feel like you have some. Like, for example, if I hadn't had any sleep, I'd just pop some concealer on and you wouldn't be able to tell.
For me, on the other hand, I just look bad.
Yeah, so like, for example, it's a nice way of self-expressing to me. But I don't wear it to really self-express at work. I wear it more to feel a bit kempt. You know what I mean? It's more of a, okay,
You're
now
gonna
I
have
don't
to
look...
explain a lot of this for me because I cannot relate in any way.
Okay, so like, let's say I'm going on a night out with my friends. I'll pop on a red lipstick, no problem. I'll look good. But I
Sure.
wouldn't want to wear a red lipstick while I'm treating patients. I don't know. To me, I don't think it's the most appropriate thing. Some people might make it, like, you know, it might not look too extreme on some people. You know what I mean? For example, I like to put eyeliner, but I have very small eyes. No matter how much makeup I put on my eyes, it won't look extreme. But with someone with very big, beautiful eyes, if they just put a bit of eyeshadow, it might be like, whoa, that's a lot of makeup. So it really depends. It's a very subjective thing. Very, very subjective.
Do you think that patients should be allowed to comment and potentially refuse treatment? Treating doctors based on, let's say, things like makeup, dress, etc.?
It depends. I've had an interaction like this. Like we're in the middle of a code blue.
Code blue is when someone's heart stops just in case someone...
and it's very
people don't
busy. Doctors just start storming into a room. It's like the movies. This thing is just like the movies.
Yeah.
It's one of the only things that's just like the movies. Yeah, if you're a code blue room, whatever, people will start storming in.
Yeah.
So yeah, we're in the middle of a code blue. It was in one of the shared rooms. I wasn't inside for the code. I was just outside filling in consent forms, just to trying to help out where I can. And then the mother of the patient who was coding just looked at me when I was trying to consent her for the central line.
Yeah.
And she was like, "You're a doctor. Like, why do you have makeup on? Why is your hair so big?" And I was very respectful and nice with my response because, one, her son is coding. I'm not going to be like, it's my face, I'll do whatever I want. You know what I mean? Like, I was...
Well, that's good of you,
I was
to be
quite
honest.
sympathetic.
That's really nice of you because I don't know, there's
I don't know many people that would do what I
like,
did.
you
But
get a
I'm
little
like,
bit
her son
triggered,
is
like...
coding. She's an old lady. Like, just be nice, Hala.
Yeah.
I mean, I just had to, just let it slide. I don't let things slide. But this one, I was like, yeah, let it slide.
So what happened?
So I was just like, but I was very firm at the same time. I wasn't like just ignoring her. I was just like, my face is my face, and I tie my hair when I'm around patients. I'm in the hallway right now, but I was like, is there anything I can do for you?
And what was her response?
She just smiled.
Really?
Yeah, she was nice to me.
Sorry, I'm a bit taken aback here. Like it's a very bizarre situation.
Yeah,
because
I was firm, but at the same time I was nice. I wasn't like sassy about it, like how I usually am. I wasn't sassy at all. I was just
can I just mention, Hala's very sassy, especially in her notes. I have seen the passive aggressiveness reflected in the notes. Amazing notes though, but
document. Those are the rules of a meeting.
Yeah.
Whatever you do, you document. Because like I was very firm about it, but I was very respectful at the same time. Because like she, like Mara Kabira, you know what I mean? Like she's an old lady, and I'm like I'm not gonna start something in the middle of a code blue. You know what I mean? So I was just like Khalti, like This is my face. I'm free to do what I want with it. And I tie my hair when I'm around patients. Can I do anything for you? Can I get you some water? Can I get you anything?
Do you think that this is the experience that you went through, right, with that patient and with that situation? Do you think that there may be here an element of the male versus the female doctor experience in Kuwait?
In what way?
Like, do you think that male doctors would be, like, I cannot imagine being in that situation. Like, I don't think that generally patients, so long as I'm wearing scrubs and I don't look like I swam in some trash, I don't think that patients are going to come to me and have, I don't think they're going to come and say, hey, what are you wearing? Why are you wearing this? I don't know. To me, this sounds like a more unique to the female perspective in medicine.
It could be. I mean, like, I know some male doctors with, like, sleeves and, piercings and
sleeves,
long
you mean
hair.
Tattoo sleeves?
Yeah, it's like tattoo sleeves. And I've seen some patients comment. So it's not just a female thing. Yeah, I've seen some patients comment. But, like, they're less, I don't know, like, they're more brave when it comes to speaking out when it comes towards more females from my experience. Like it was a dude doctor, they'd just be like, oh, okay, you, but like I'm not gonna say anything because he's like a dude. If it's like a girl, they might be like it was in the middle of a code and she commented on my face like ma'am, your son is dying, like maybe shift your focus on that. You know what I mean? It was very bizarre, but when people are put in difficult situations, like you don't know what their reaction might be. So I was very understanding,
Dumb question, but during a code, when you're doing CPR, earrings,
just make sure you have very secure ones. I don't wear earrings for that reason.
Okay.
I wear bracelets, like the love bracelets. I make sure because like you use it's like a mini screwdriver to like make sure they're secure. I make sure I adjust them every night before I sleep.
You have a screwdriver for your bracelets?
Yeah,
Wait, so do you wake up in the morning and then just screw your bracelet on?
You don't have to do it all the time, but mine are a bit dodgy. You know what I mean? Like they keep.
I just find that a bit funny to me.
They keep like getting loose. So I make sure like before I sleep, I just adjust a few of them.
Sure.
Because I wouldn't want that opening in a code blue.
Yeah, I know for me, like, because I always wear a watch at work. Yeah. And usually in a code blue, when I get to the patient, I'm taking the watch off. I take off most things. Like, I'll take off my stamp, my watch, my stethoscope, whatever, everything, same. Put it to the side, and then proceed.
Even like lanyards. That's why I don't wear my lanyard.
I don't like lanyards personally.
I don't like lanyards.
Too dangly.
Because they're dangly. Like every time you examine a patient, you lean over, it's like it's in their face.
Yeah.
And especially in a code blue, that's the last thing you want. So what I used to do, like if I'm running to a code, the first thing I do is if I'm wearing a jacket, I take that off, remove my stethoscope, everything in my pockets out, throw on whatever couch I find, and then while I'm walking, I tie my hair.
Okay.
I always have like at least 1 or 2 hair ties on me, and if I don't, I grab a glove and I tie my hair with that.
Wait, what?
Yeah, you know where the glove ends?
Useful fashion tips by Hala
Allafi. Yeah, honestly, you know where the glove ends?
Yeah.
Like where it ends here.
Sure.
Just rip that bit out, like all the finger bits.
Okay.
And you'll just end up with a circle band.
There you go.
And that's what I use to tie my
hair. I really
hair.
respect the hustle there. I really do.
Yeah, you want to know how I found that out? I was once in a Sims lab.
What?
Like the lab.
Oh, simulation.
Simulation lab.
I thought when you said Sims, I thought you meant the video game.
No. One in a simulation lab. And I was like, yep, I'm getting yelled at by the nurses because my hair wasn't tied. So I just found a glove and I was like, what if I rip it and make my own hair tie?
Have you seen anyone else do this?
No.
Okay. I really, really hope this becomes a trend.
Yeah.
For whatever reason. You should stop carrying hair ties and only carry gloves.
Yeah.
That's my recommendation.
Yeah, so if you don't have a hair tie, it's not an excuse.
There you go.
You can make a hair tie with gloves. So so like if I don't have that, or I just like shove it inside my shirt.
Wait,
my hair because it's very, very
Oh,
long.
okay.
Just take it and just shove it in my shirt.
I don't think that would work for me. Now, going back to sleeves.
Oh,
the
you said one
tattoos.
thing. You said one thing that we didn't answer. Like, do you think patients have the right to be like, I refuse
Oh,
treatment
yes, sorry.
from this
Okay,
person?
keeping me on track. Good job.
Yeah.
Yeah. Do patients have the right to refuse? You know,
If
just
it's
be like, I don't
affecting
want.
their care in any way, you know what I mean?
But what if I just have I have long hair. I'm a male doctor. I come in and they're just like, what is this guy? No, I don't like this. Get out.
Then absolutely not. No, I don't
Okay.
think it's okay.
Okay.
At the end of the day, you are a doctor. You have a degree. You're up at 7. You're up at 6 and you're in hospital at 7 a.m. You're doing on calls. You're working so hard.
Yeah.
No one should have the right to be like, I don't want you to treat me because of the way you look.
Yeah.
You know what I mean? It is a form of discrimination, and I think we should be very firm about being like, you don't want that, then
Too
cool,
bad.
ciao.
Yeah. Yeah. Yeah.
You know what I mean? If I don't know, if someone had a tattoo and a patient was, I'd get why they'd want to refuse treatment from them because that is very offensive.
Yeah.
But you can't be like, I don't want you to treat me just because I have red hair. You know what I mean? Or
Yeah.
or I have tattoos. You know, that's my body. That's a way I want to express myself, and that's my business. I'm here to provide a service for you.
Yeah.
And that's it. We're not friends.
Yeah. No, I agree. Now, one thing with tattoos, especially sleeves.
Yeah.
I think this is a bit of a polarizing issue because I guess at some level I can see both sides of the argument. You know, a lot of people would say, yeah, great self-expression, fine, but that does not look professional. Like if you were to wear a shirt, you know, with that sleeve, just regular, like because you know they sell those shirts.
Yeah.
Yeah. So like imagine that. Some people would say like, no, those graphics, those images, whatever, that's not something that you know is very professional to look at. Other people would say, well, great, but that's self-expression. What's your advice?
Honestly, the one tricky thing about tattoos that are visible is that some hospitals don't allow them.
Really?
I think
Just
it's
flat out don't allow.
Not here. I don't know.
Okay.
Like in other countries and like in some, maybe in some hospitals in the States. I think I've read. I'm not sure if I'm right or wrong. But like some hospitals don't allow visible tattoos, and that might affect your chances of working somewhere. That's the only thing I'd say. I think they look really cool. I love tattoos. You know what I mean? Like I don't have any, but I think they look really cool. As long as they're not offensive, you know what I mean? I think they look really cool, and I don't know. Some of my mentors had sleeves, and they were really, really, really good at what they did, and they really just didn't care. They'd be like, yeah, like I'm very good at my job, and yes, I'm tatted. Who cares?
Exactly. Like
you
this
know
is
what I mean?
my
Like,
choice.
Exactly, and I like that, seeing people that look different, that are different, that express themselves and through body art.
But do you think we're ready for that in Kuwait? Like that's another thing. Like okay, great, we feel that way, but we are working a job that's treating the public as a whole, and the public as a whole, we do need to bear in mind their cultural values and their opinions on certain things, even where we disagree. You know?
Yeah. I mean, that's the thing here. It's like in some like divisions of Islam, it's okay to have tattoos. So who am I to say, oh, you can't have a tattoo? Well, in my religion, it's okay. You know what I mean? And some people, no, it's not okay. So I mean, we do live in a country with people that have different opinions on tattoos.
There is a diversity here.
Yeah. And I think we should all respect that. If it's a very personal thing, which is why I don't think anyone should have the right to comment on. So I've seen some really cute tattoos on people, like walking around the wards, women, men, and they're really nice. I've never had an issue with it. You know, it never affected my interaction with them. It never affected the way that they deliver patient care. So why should I care? You know what I mean? Like,
True.
I don't know. I'm a very indifferent person. I just really don't care.
But again, going back to this example of you have a nephew and they're about to start, okay? Bearing in mind the cultural landscape of Kuwait, okay?
Yeah.
Would you tell them, hey, maybe hold off from getting a tattoo? Not because you agree with it.
Not because of, I don't know, the backlash that might get.
Yeah. Like again, that was my situation. My experience was I had long hair, and I really did feel that people would take me less seriously with long hair, and I did not want to give that first impression.
It really depends. Do they feel like putting up with the comments?
Okay.
If you don't care, like me, عادي. You know what I mean? If someone
That's
has something,
actually really good advice. You just need to be aware of the consequences.
yeah, like are you willing to like deal with the comments?
Yeah.
You know what I mean?
Like I wasn't. I like flatly. I
Yeah.
caved in. I didn't want to deal with anybody. Kind of being like, why does he have long hair? I did
Yeah.
not want those comments.
Yeah, and that's fair
Starting out,
enough.
yeah.
That's fair enough. It doesn't make someone not brave. It just
Yeah.
means like mali khulq. You know what I mean?
No,
and then
really,
that's completely
truly.
acceptable.
Yeah.
Like I dyed my hair bright red and I didn't care. Like you're gonna
Yeah, I
say
remember.
something, I'm gonna say 10 things back. You know what I mean? It's my hair. I'll do whatever I want with it.
Yeah.
At the end of the day, it's clean and it's tied back. It's not affecting your care.
Yeah.
You know what I mean? It really depends. If they're like me and they're like, I'll do what I want. It's my body. It's me self-expressing.
Mm-hmm.
Then go for it. But if you're like, I don't feel like dealing with people's comments, and I'm like, maybe you might want to reconsider that. You know? And I don't know. I think our generation compared to the generation before is way more outspoken and way more self-expressive when it comes to the way we look and the way we present ourselves.
That's true.
You see more tattoos, you see more cool hair colors, haircuts. It's just very refreshing in my point of view, and I think it's very cool.
Let's shift it. We talked about hair.
Yeah.
I'm assuming we meant head hair. What about beards? So what's your opinion on kind of facial hair for men? Because that does play a role in being professional in the hospital and stuff.
It really depends. 'Cause like it's not just that. Like even like remember in the UK, I don't think it was allowed to wear a niqab if you're treating patients. It's just a form of
Really?
safety. Yeah, because
I did not know that.
You have to see
Really?
someone's face if they're treating you.
Wait, so are you comparing the beard to the niqab?
No. I'm very ADHD. I jump from topic to topic. Because we were talking about faces. I was like,
Yeah.
that's quite an interesting topic. It didn't come from a like a side of like discrimination. It came from you have to identify yourself to patients.
Yeah.
You know what I mean?
We don't have that in Kuwait because I've
no.
seen plenty of doctors.
Yeah, I've seen plenty of people with that. So
niqabs, yeah.
it's cool to see how religion does play a role when it comes to rules. Even though this is a hospital and that's a hospital.
Yeah.
Beards, it's the same thing here.
It's all
Beards
respecting
are-
the culture you're operating in.
Exactly.
Yeah.
Beards, for example, here so many men grow their beards. كسنة, you know what I mean?
Yeah.
Even the UK, there's so many Muslims there. But to me, I do not have one, so I don't really.
You don't have a beard?
So والله ما أدري. I don't know what to say. As long as you look clean and it doesn't look too, يعني unkempt and outgrown and just gross. I think it's fine. Most men here have beards, but I remember you guys had to shave them during COVID for the N95 masks.
Oh, I forgot about that. Yeah, so that's one thing is that.
Why did they make you shave them? What was the?
So it's because the
How did they justify
N95
it?
masks are various sizes, right? And then so having a beard or a mustache can throw off the size, and then because that's going to change week for week, you're making it less effective. So like let's say you're wearing one size, and then you have your beard gets a bit longer next week, you're a totally different size, and then you're wasting hospital resources because you have to get a different mask, and we were already in a shortage, et cetera, et cetera, et cetera. I was one of those people that all the N95 masks just didn't work on my face for some reason.
Oh yeah.
Yeah, they just didn't fit the shape and contours of my face. But going back to the whole beard thing, I will say that working in the hospital in MD, whatever, has made me way more conscious of my facial hair.
In what way?
So I got more like, let's say before I was lining up my beard and stuff maybe once a week and trimming whatever. I'd say now it's on the daily at night.
Daily basis.
Yeah, all the time.
To be fair, beard on men here, it's like makeup for women. It's like
Yes, it's all we have.
Yeah. Honestly,
we get one.
Honestly, like if I was a dude, I'd totally take care of my beard because like that's, you know what I mean. I make sure it looks good all the time. And it's like we have makeup, you guys have facial hair. You know what I mean?
I mean, that is our facial hair, to be honest. That is our makeup, is our facial hair, because it covers up our blemishes, blah, 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 blah. But not everybody can grow a beard, so...
Feels bad.
Feels bad. I mean, I guess what it comes down to ultimately with all this discussion about fashion and medicine is just... We said the word clean a lot. And we talked about, kind of infection spreading and stuff like that. I really do think that in the end, it just comes down to those two words. It's professionalism and looking clean.
Yeah, honestly, if you're ever put in a position where, like, I have 5 minutes, it happened to me so much. I've got 5 minutes and I need to leave or I will be late. What am I going to do? Quick 1 minute shower, tie my hair, deodorant, no need for makeup, and I'll just do it in the car or in the bathroom if I have a break. Those are my priorities, is being clean, having clean scrubs on. Looks come secondary to me.
Yeah.
If I have time, I might do like a quick 2-minute makeup thing, but if I had 5 minutes, it's going to be shower over makeup any day.
Yeah.
You know what I mean?
Yeah. And people pick up on that vibe. They can pick up on, being clean, you being dirty.
Yeah. A few times, like I show up to work and everyone's like, oh, like you look tired. I'm like, yeah, it's because I don't really have concealer on. But they'll never be like, oh, you don't look clean. You know what I mean?
Yeah.
I might look tired. I might look groggy. I might not have... I might not look like I have life in my face, but I will never be that doctor that doesn't look clean.
Yeah.
That is a guarantee. That's one thing I'd say. Like, even nails, like, I started to really hate long nails when I started working in the medical field.
Yeah.
I think those are one of the rules that, honestly, like, you shouldn't have long nails as a doctor. It's like, I'm very flexible. Like, during this talk, I was very like, yeah, it's not really black and white, it's gray. When it comes to this, it should be black and white.
Yeah.
Because, like, nails, when they grow long,
they stab patients.
Other than stabbing patients, it's gross. Like, things will fall under them. You know what I mean? And you can't always, like make sure they're clean all the time. You know what I mean? And they will hurt people, and like, you will.
You're
pop
just
gloves.
palpating the abdomen and you're just clawing your patient.
Imagine doing a DRE on someone with long nails. Like, ouch.
Oh God.
Yeah, I wouldn't want that. You know what I mean?
I will not define what DRE is. I think our viewers should go and look it up for themselves if they don't know it.
Yeah, like, I don't think that's appropriate at all. Like, I'm going to start working in peds on Sunday. Imagine having long nails and, like, working with kids. You don't want to scratch a kid, you know what I mean? You don't want to scratch anyone.
Yeah.
You know what I mean? Like, I think nails should be short, they should be clean, they should be practical. Because they will break. Like, no one loves getting their nails done more than me. But working in hospital, your nails will break. And it hurts when they break. Like, I once had a nail, like, just pop off and, like, ouch.
Actually, really the amount of times I've had female colleagues of mine just be like, oh my God, now my nail's broken.
Yeah, and, like, it's much easier, you know what I mean, when you're working. Like, I can't think of a single medical job where you can justify long nails. Like, aesthetics, you're injecting people and you can't inject them with long nails. When you're a trainee in hospital, you're doing
like, if they attack you,
ABGs and NGs, like, you will be doing a procedure. Even in, like, family medicine, you will be examining patients all day. So, like, I can't really find a justification for long nails. Everything else, I'm a bit chill about it. But long nails, guys, they're really gross.
And now, is it fair for me to also say that we should promote more that people support local brands for scrubs in Kuwait?
100%. I'm always for supporting local brands.
Yeah.
Like, just for the economy, and, like, why not? Like,
I just like the fact that it will reflect our culture. You know what I mean? Because when the more that our brands are reflected, like, the more people wearing local brands in Kuwait, the more that the Kuwaiti taste, the Kuwaiti style becomes more distinctive, and it's more prominent even in the hospital.
Yeah.
And it's something that you do appreciate. You do appreciate being in the hospital and seeing our uniqueness on the grand scheme, like, compared to other places.
Yeah, I love it. The thing I love about Kuwaitis is that they're very creative. They're very innovative. They love forming new ideas and actually seeing them through.
Yeah.
And it's like, why not start a business? Cool. And they end up starting a business and it ends up being amazing.
Yeah.
And then you just see people wearing those scrubs all over the hospital. And I'm like, yes, represent. Awesome. So I think it's very interesting.
Yeah.
It's very cool. And I like seeing it. And
Yeah,
I want to
so
see more of
everybody,
it.
please, if you're watching, go look.
Support your local brands.
Support your local brands. Go look for them. And yeah, I think that's a good place to call it for today.
Yes.
That's the last sip of coffee for today. Again, a special thank you to my lovely guest, Dr. Hala Allafi. I really appreciate you coming on, and I hope everyone listening really benefited from your tips and your advice, and just your fashion sense in general.
Thank you. It was lovely. It was lovely being here. Thank you for having me.
And
for listening.
Yeah, for everyone listening, if you like the show, please comment, like, and subscribe. And that's a wrap. Hope you all enjoyed this episode of the Doctor's Brew. New episodes to listen to with a cup of coffee coming your way every Sunday on YouTube and Spotify. And be sure to follow us on Instagram for all the latest updates. See you next time.